Hello, Namaste, and welcome you all to Easy Ayurveda Hospital's YouTube live program. This is our second attempt with a live program. Just a couple of weeks before, we did one live on busting the myths about Ayurveda. Today, in India, we are celebrating the Children's Day. Yesterday, we just celebrated Tulsi Puja, where we worship Holy Basil. We revere the Holy Basil plant as Goddess Tulsi. So today being Children's Day, we are going to discuss about children's health. One of the basic, so with Ayurveda explains about children's health, starting from the birth of the child, birth of the infant, birth of the newborn baby, till 16 years of life. That is usually considered as childhood, as per Ayurveda. As you might very well know, just a few decades before, just like 50, 60 years before, for whatever problems, people were going to Ayurveda in India, and Ayurveda was the only medical system that was existing in India that was providing all the healthcare solutions that the patient was requiring. So not so surprising that in the child care, starting from the birth, soon after birth, how the child should be taken care. After 1 week, what should be the child care that should be given. After 1 month, what should be the child care that should be given. What the play, like it's explained as Balagara, meaning how the room where the child is living, or the infant, the baby is living, how the infant care room should be set up, like all the medical equipment required, the medicines required should be easily available, what the toys that the child should have, the baby should play with and should not play with. All those things are very detailedly explained in Ayurveda. So coming to the infant care from 0 to 1 year of the child, so how to take care, there are many things that are explained in Ayurveda. So one such concept is called as Swarna Bindu Prashana. This Swarna Bindu Prashana is a kind of Ayurvedic immunization care that is explained with Ayurvedic immunization, or so to speak, an Ayurvedic form of vaccine called as this Swarna Bindu Prana. Some people call it as Swarna Prashana itself. So in this Swarna Bindu Prashana, like vaccinations, etc., have become very famous, and they save lives and all in this modern world. So in ancient times, with Ayurveda, Swarna Bindu Prashana was the mainstream vaccination method to protect the body and mind from the diseases and to maintain good health with strong body and strong mind. So there are three main components in this Swarna Bindu Prashana. First one is this Swarna. Swarna refers to Swarna Bhasma, or gold calx. So here a very thin plate of gold is taken, and that is processed with a lot of herbal decoctions. It is heated and dipped in Trifala Kashaya and many other cow milk and many other liquids, and then its purification is done. So after the purification of these thin foils of gold, then they are subjected to what is called as Marana. So here they are subjected to intense heat up to anywhere between 700 to 900 degrees Celsius. That too for multiple times. That is triturated with a lot of herbal oil and herbal decoctions and powders, and then they're taken in a closed container, and then which we call as putta, and which we call Sharava Samputa, and anywhere between 600 to 900 degrees Celsius of heat is given, and then finally what we get is the powder form of the Swarna, which we call as golden calx in English, and which is called as Swarna Bhasma in Sanskrit, in Ayurveda. So in Ayurvedic immunity, or an Ayurvedic immunization method, gold holds a very strong position. So there is a classical shloka in Charak Samhita which explains, Na sajjate hemapange visham Padmadale Ambuvat. It is a very interesting shloka explained by Acharya Charaka. So Acharya Charaka explains, Hemapa Ange. Hema means gold, Anga means the body. The body which is habituated to gold, meaning in a person who is taking gold continuously, gold here should be taken as Swarnabhasma or gold calx, albeit in a very minute tiny quantity in about like mg's dose. So Hemapanga, in a person who is taking gold or Swarnabhasma continuously in a very small dose, na sajjate visham, in the body of that such a person, the visha, the poison, na sajjate, will not affect the person who is habituated to gold consumption. In him, the poison will not affect. This is explained exactly in Charaka Samhita textbook written by Acharya Charaka. So they also Acharya Charaka also goes on to give a simile to press his point home. So he explains, Padma Dale Ambuvat. Padma, lotus, Dala, lotus leaf, Ambu means water droplets. Like how the water droplets will not stick on to the lotus leaves, it just pops out. The water droplets just pops out as soon as they come into contact with the lotus leaves. Similarly, the poison in a person's body who is habituated to Swarna will pop out, will not get in or will not be in the system for a very long period of time. So that is the power of Swarna. So Swarna is naturally antitoxic. It's used in the treatment of poisoning. It's used in it is also used in the treatment to improve immunity power of the body. That's why in ancient times, if you see the pictures of ancient kings, usually the kings were commonly and constantly attacked with a lot of poisoning, food poisoning or like external poisoning, or even the arrows were, the tip of the arrows were laced with poison and they were shot. All those things were there. So these kings of the olden times, they were having food in golden plates, or at least silver plates in some cases. So the idea was that when they're having the food in these golden plates, some micrograms, nanoparticles or nanograms of these golden particles of the golden plate enter in the body system, and once they enter the body system, they'll help to provide protection towards poisoning and also will boost the immunity of the king. So I think we have very well established that Swarna Bindu Prashana that is given as an immunization schedule. In that, Swarna Bindu helps to provide immunity. It also detoxifies the body and also protects the child's health from all the virus, bacteria, yeast, etc. infections that is there in the atmosphere. So another interesting thing in the Swarna Bindu Prashana explained by Acharya Kashyapa himself is the ghee. So ghee is explained in Ayurveda as there's a textbook called as Ashtanga Sangraha, written by Vruddha Vagbhata. He is an ancient master. So Vruddha Vagbhata explains that ghee as Janma Devata Shilanath means the ghee is habituated the body by the birth itself. So children can be given ghee as well. And then ghee is also explained as medhya. So medhya means which improves the memory, intelligence, focus, concentration, etc. So Swarna Bindu Prashana also contains this memory enhancing, improving component, which is ghee. And if you study even from the modern biochemistry, modern pharmacology point of view also, because brain is the central processing unit of the body and it needs protection, that's why we have the skull bones protecting the brain from all the external injuries and acts as a shock absorber and all. So internally also there is some sort of a barrier which is called as blood-brain barrier. So to pass this blood-brain barrier, the molecules or the food, the molecules, it can be food, nutrition, or it can be the medicinal principles of the herbs. They should be lipid soluble. So only the lipid soluble contents or the contents which are emulsified in the lipid medium, only they can pass through the blood-brain barrier. That's why if you open Charak Samhita and start reading about the psychiatric disorders which is called as Unmada Chikitsa, in that chapter, and also in Apasmara Chikitsa which deals with seizures and epilepsy, if you read those chapters, it clearly explains that most of the herbal medicines which are explained in that are prepared in herbal ghee format, because thousands of years ago, at least 3,000 years ago, the ancient masters, ancient Ayurveda masters were clearly knowing that to pass the blood-brain barrier, ghee is a very good medium, because herbal ghee, what is herbal ghee? Herbal ghee is processed, the many different herbs are processed and infused in the herbal ghee format. So this herbal ghee contains all the medicinal principles of Brahmi, Vacha, Rakoras, Calamus, Shankapushpi, Jyotishmati and all these herbs, Yasti Madhu, licorice, all these are brain tonics. So these herbs are infused in the herbal ghee medium. So infusion means whatever the fat soluble, lipid soluble active principles of the medicinal herbs that are infused into the ghee medium. So then the medicinal principles, when they are taken in this ghee medium, when patient takes this herbal ghee, it crosses the blood-brain barrier. So along with the ghee, these medicinal principles also reach the brain. So I hope with this narration you have well understood that ghee improves memory and intelligence as well. Ghee is also very good for the body as well. There is this unnecessary notion that ghee being cholesterol and it's fat, and fat is not good for the body, so on and so forth, many things are there. But the Acharya Sushruta explains ideal qualities of food or ideal qualities of a meal. In that he explains ideal quality of meal is snigdam. It should have some amount of fat in it. So why not we take ghee regularly? Ghee is a good fat. Next, ushnam. The meals should be like freshly prepared and served hot. It should not be cold and refrigerated and reheated. That is not explained as good food as per Ayurveda. So snigdha, ushna and dravotara. Dravotara means moist, meaning the food should have some amount of moistness in it so that it is well chewed and well consumed by the body. So the next is the food should also, so that's why the ghee in the food also plays a very big role. So even in the children and infants, when we give Saranabindu Prashana, the second important component is ghee. Remember, ghee improves mental health and also physical health, and it is told as Janma Devashta Shilana, means it is congenial to the body from the time of birth. Next component in the mix of Saranabindu Prashana is honey. Honey acts as a very good vehicle. So vehicle or catalyst. For example, you give a medicine and it takes X amount of time to reach brain or reach lungs or reach liver, etc. Wherever the disease is there, the medicine has to reach that organ to show its action. Let's say there is this medicine, for example, Talisadi Churna, which is used in cold, cough, asthma, bronchitis, and all those conditions. And we take this Talisadi Churna without honey, and let's say it takes, so once we take Talisadi Churna, it has to enter our stomach, then the intestines, then it gets absorbed through the intestine into the bloodstream, and then finally it enters and it reaches the lung, where in the lungs it acts as a bronchodilator or antitussive to relieve the cold, cough, asthma, etc. So in this Talisadi Churna, if it is taken alone, let's say it takes around 1 hour from oral intake till it reaches the lung and shows its function. With ghee, when it is taken, it takes only about 40 minutes to reach the lungs to show its action. That's why not ghee, honey. So Talisadi Churna is usually advised with honey. When it is taken with honey, it takes only 40 minutes, whereas when it's taken alone, it may take around 1 hour time to reach the lungs to show its action. So that is the power of honey. It acts as it improves the bioavailability, it acts as bioavailability enhancer, it acts as a catalyst, it makes the travel of the medicines to their target organ faster. So that is about honey. And honey is also very good for body health also. That's why it is there as an ingredient in Swarna Bindu Prashana. So there is an interesting concept in Ayurveda called as Viruddha Ahara, wherein two food combination, when they are combined and used together, it can act as a poison. So interestingly, this ghee and honey, when it is told that when they are used together in equal quantities, suppose you take say 20 grams of ghee and then 20 grams of honey, mix it and take it, that is considered as a poison as per Ayurveda. That is not congenial to health. It can cause digestive problems, it can cause weak immunity, it can cause, it may make the person too prone to many diseases, so on and so forth, are explained regarding the ghee and honey combination. But interestingly, in the Swarna Bindu Prashana, ghee and honey is given along with Swarna Bhasma. So we use the Swarna Prashana in our day-to-day practice in our ECR, the hospital. That's why I am confidently explaining about this. So this honey and ghee, how it acts as poison and what is the role of this Swarna Bhasma in that. So one is that when we learnt that the Swarna Bhasma helps the body to get rid of poison and get rid of infections as well. So let's take the example of vaccines. So what is a vaccine? Either it is a dead virus or bacteria, or it is live attenuated virus or bacteria or any microorganism. Live attenuated means it is weakened, it's almost like half dead. So that when is ingested into the body or introduced to the body, either through oral intake or through the injection, when it is introduced to the body starts fighting with the dead or the weakened virus or bacteria. Then the body, white blood cells and all the immunity factors in the body, they get training how to fight this weak or dead bacteria. Then those antibodies will be there in the memory of these white blood cells in the whole immune system, and then when the actual strong bacteria or virus attacks the body, then the body already has sufficient mechanism to counter it. So that is the way how vaccine works. So similarly, here in this Swarna Bindu Prashana, when herbal ghee and honey are given in 1 drop each, meaning in a very low quantity, the body itself will develop immunization or defense mechanism towards such a poison. So in that, Swarna Bhasma being antitoxic, it also helps in improving the toxin fighting strength of the body. It stimulates immunization, it stimulates the white blood cells. So that's why this Swarna Bindu Prashana is a perfect mix to improve one's physical health and also mental health. So Acharya Kashyapa in his textbook Kashyapa Samhita explains that this Swarnabindu Prashana should be given continuously for 6 months time. But if you're in India and if you have seen this Swarnabindu Prashana administration, usually it is administered once a month in Pushya star day or Pushya Nakshatra day. But actually in Easy Ayurveda practice, in Easy Ayurveda hospital also, we practice that the Swarnabindu Prashana is given to the people every day for continuously for 6 months. Usually in infants between the 6 months to 1 year period, the dose that we give is usually 1 drop per day only. So it's very mild dose, around half mg to 1 mg of Swarnabhasma enters into the body, which is very safe. And we are all experienced doctors here at Easy Ayurveda Hospital. We examine a patient and only administer these Swarnabindu Prashana or any other medicine for that matter. So the dose of Swarnabindu Prashana after 1 year up to 3 years is 2 drops. From 3 to 5 years it is around 3 drops. And then from up to 16 years is up to 4 drops per day. So that is about Swarnabindu Prashana. So which is used effectively in the care of the child to improve strength and immunity of the child, and also to improve the mental acuity, mental alertness, focus, concentration and memory of the child. This Swarnabindu Prashana is very good. Next point that I want to talk about children's health is related to same Swarnabindu Prashana. I just want to cover one question that many people ask. Okay, it was given, it should ideally be given, the Swarnabindu Prashana should be ideally be given around in the first year or second year, or at least till the third year. In the toddler age group only it should be given. But many parents come here at Easy at the hospital and ask me that, okay, my child, I was supposed to give it at an earlier age, but I didn't know medicine existed in Ayurveda, but my child is now 10 years or 12 years or even 16 years, can it be given now or not? So answer is yes, it can be given. Even in the old age also we sometimes use this Swarnabindu Prashana as a regenerative and anti-aging medicine to revive our brain cells and whatnot. So it can be given even in the children of a teenage group as well. Next point I want to talk about is the food of the infants. Nowadays this ready-made formula makes baby care formula, baby food formula. There are umpteen number of formulas available for giving to the infants. Many parents come here and say that, doctor, we started giving this formula food at a very tender age of like 2 months and 3 months, etc. No, that is not recommended. As per Ayurveda, up to 9 months to 1 year, mother milk is good and it's sufficient enough. But we live in this modern age, and if I tell that, one year till 1 year, no need of any other thing, only the mother's milk is good enough, nobody is going to give that. People do not have much patience these days. So at least, if not 1 year, let us restrict all other types of foods till the baby grows up to 6 months of age. So till 6 months of age, let's not give any other thing except for mother's milk. This, at least if you follow this, will be taking care of the gut health of the child. What happens if you give this formula foods and this food, that food, etc. at a very early age is that the digestive system, the inner layer lining of food pipe, the stomach and intestines are very tender. Even for a normal person like you and me, they are very tender. When that is the case, in an infant who is just newly born, like it's just like 2 months, 3 months old, in such a infant, they will be like ultra tender. If you abruptly and quickly and without without thinking recklessly, if you start solid food at a very young age, later it can cause a variety of digestive issues, indigestion issues, the gut health will be severely affected. The child may develop vomiting, diarrhea, and blisters, many different things we also we see on a day-to-day basis. It also affects the milestones, meaning the gradual development of the child, month by month, year and year. There are different milestones given. So children will not be able to hit those milestones if abruptly food is introduced well before the child is 6 months old. So between the 6 months to 1 year period, slowly and gradually, one by one, different types of liquid foods can be started with. So first, better to start with the liquid foods and then slowly move to the solid foods. So this shift should start from the liquid foods first, meaning the cow milk or buffalo milk or goat milk. These are good to start with. Or if you are using rice, we prepare something called as a rice manda, or we also call it as ganji. So that ganji or kanji, which is called in Tamil Nadu and those areas, that is good to start with. Just pure watery rice is sufficient to start with after 6 months of time. Then slowly from there on we can go into some semi-solid food like a cooked apple, or if the child has constipation, then a little bit of prune in boiled format. So, and a lot of fruits etc. can be given, introduced to the child, maybe like a sweet lemon or musambi, orange. These are good to start with. So when we start these things, so then semi-solid things are started. So even the rice can be cooked a little more extra and it is mashed well, then semi-solid foods, and finally we should switch on to solid food. So after till 6 months there is nothing required except for the breast milk. Of course you can give water sometimes to the infant. After that you can switch on to gradually into liquid foods, then semi-solid foods, and then solid foods. This should be the normal sequence of food that is given to the child. Next is like importance of massage in the growth and development of the child. The oil massage or abhyanga, it was part of our daily routine since thousands of years. Somehow we have stopped applying oil onto the skin. When we advise our patients here at Easy Ayurveda Hospital to take up abhyanga etc. Oh no doctor, there is no time to do it, or the oil is too sticky, or I cannot, even if I take bath also the oil can remain on the skin, like I have a meeting, I have to go out to work. A lot of thousands and thousands of complaints I hear every day. But in the ancient times, let's see what they explain in the ancient times, and even if that pushes you to take up a regular oil bath, like oil massage and the lukewarm water bath, I will be very happy. So the sloka is from Ashtanga Hridayam textbook. The sloka says, Abhyangam acharet nityam sa jara shrama vataha drishti prasada pushtiyayuhu suswapna tvak dardyakrit. So Acharya Vagbhata in his treatise Ashtanga Hridayam explains, Abhyangam acharet nityam. So nityam means daily, Abhyangam acharet. So the Abhyanga or oil massage should be taken daily. Sa jara shrama vataha means vatahara, shramahara and jarahara. So what do you mean by jarahara? Jarahara means old age diseases will not affect the person, meaning the person can live strong, hale and healthy till his last breath, which should be the dream of all of us, to live a long life and to retain our capacity to listen, to hear, to perceive the taste with the tongue, so on and so forth. We should live long with a good disease-free life. That should be the goal of everyone. So, Abhyangam Acharyad Nityam Sajara. So it takes care of the long early aging. And then Shrama, Abhyanga daily oil massage decreases Shrama or decreases fatigue. In Easy Ayurveda Hospital, we treat a lot of cases related with chronic fatigue syndrome. It has become one of the very common complaint that many people complain about. So chronic fatigue system.